All right, so in the adult, we have 26 bones within our vertebral column. However, as infants, there are 33, and that's due to fusion as we become adults. So the fusion has decreased that number. All right, so the vertebral column is very important because it helps to provide support for the body, also helps to support the weight of the head, and helps maintain an upright position for our body. And there are several regions that we have. First, we have the cervical region, and within the cervical region, there are 7 vertebrae that we find. This is important because the first cervical vertebrae is the one that articulates with the occipital bone of the skull. And then these are commonly known as our neck bones. Then the thoracic vertebrae, there are 12 of them, and these will articulate with the ribs, and so helping with support of those internal organs. We have 5 lumbar vertebrae, which is commonly known as our lower back. And with our sacrum, we have 5 bones when they fuse later into a single structure by the late 20s. And this will articulate with the lumbar region as well. And then lastly, there are 4 coccyx bones that will unite during puberty. And so this is commonly known as our tailbone. All right, so here we will look at a single vertebrae and go through some of the common structures that we find. First is the body of the vertebrae. So the body is going to either be circular or cylindrical, and it is going to be the weight-bearing structure of almost all of our vertebrae that we have. And the more weight-bearing it is, usually it means that the lower or more inferior you are going down the vertebrae. Posterior to the body, we have the vertebral arch, and together the arch and the body are going to enclose a circular opening called the vertebral foramen. And so within the vertebral foramen now, this is where the spinal cord will go through. So when we have one single vertebrae, it is a vertebral foramen, but when we have stacks of them, that's when it's a vertebral canal, so that canal is making that opening for the spinal cord. Also, when we have stacks of vertebrae on one another, what forms is this intervertebral foramen, so it's in between 2 vertebrae. And this is where our spinal nerves will exit out. All right, then we have our pedicles, which are going to be part of the vertebral arch, and these originate posterior and laterally to the body. The lamina, again, making up part of the vertebral arch, will form the posterior edge of each pedicle. The spinous process is going to be posterior from the right and the left lamina. And the spinous process is what you can feel when you arch your back and you run your finger down your vertebrae. The transverse processes are going to be lateral to the spinous process, so we have a left and right transverse process. All right, then we have our superior articulating process and facet, and so these will be found on the superior portions of each vertebrae. And these now will articulate with the inferior articular, and let's do that in green now, inferior articular process and facet of the vertebrae above it. So when we look at a stack of vertebrae, if we're here superior, so I'll just type sup for superior, here we have our superior articulating process and facet, And then on this L3, lumbar 3, what we have is our inferior articulating process and facet that now will articulate with the superior articulating process and facet of now the fourth lumbar vertebrae. The first cervical vertebrae is called the atlas because it supports the head due to its articulation with the occipital condyles of the occipital bone. And this is named for the Greek mythological figure of Atlas who carried the world on his shoulder. And so this is responsible for giving us our motion of yes when we nod our head, when we're at the atlanto-occipital joint for the atlas and the occipital bone. The atlas lacks a body and a spinous process. So instead, it has these lateral masses that we find that are going to be connected by the anterior and the posterior arches. So here's one arch for the posterior aspect and then for the anterior aspect. The second cervical vertebrae is known as the axis. And interestingly, during development, the body of the atlas fuses to the body of the second vertebrae, and this is called the axis. And so this fusion produces this feature of this dens that we find here that sticks out. And so this dens is going to rest in the articular facet of the atlas, and this is what gives us our no rotation. So after the atlas and the axis, then we have cervical vertebrae 3 through 7, which they're named from superior to inferior location. The bodies of a cervical vertebrae are relatively small compared to its foramen. And the superior surface of a cervical vertebrae body is going to be concave from side to side. And where the spinous process is going to be relatively short, and the tips are going to be bifurcated or bifid, except for C7. Also unique to the cervical vertebrae is that within the transverse processes, what we find are transverse foramina, or holes, which will provide passageways for the vertebral arteries and veins for the brain. There are 12 thoracic vertebrae, and they're named T1 through T12 from superior to inferior. And these vertebrae now are going to articulate with the ribs. So here, they are going to lack the transverse foramina and that bifid, that splitted spinous process that was found with the cervical vertebrae. But instead, what they have are demifacets that are going to articulate with the heads of ribs, where we find this on the lateral side of the body and on the sides of the transverse processes. So the body shape of thoracic vertebrae tend to be more heart-shaped to them. They also are medium in size, so they will be larger than the cervical vertebrae because there is more weight that is bearing on them. Also, there are going to be, again, no transverse foramina, and their transverse processes are going to be medium in size. The spinous process here is going to be very long, and it's going to be projected inferiorly, so towards downwards. The lumbar vertebrae are the largest of the vertebrae because they bear the most weight. And so the body is going to be the thickest compared to all the other vertebrae. And the superior and inferior surfaces are going to be oval compared to round, instead of being heart-shaped like with the thoracic vertebrae. Lumbar vertebrae lack the transverse foramina that are found within the cervical vertebrae and lack the costal facets and demifacets for the ribs found within the thoracic vertebrae. The transverse process is going to be thin and it's going to project dorsally and laterally. The spinous process is also thick and it will project posteriorly, but will be shorter than that of the thoracic vertebrae. The sacrum is an anteriorly curved and kind of a triangular bone that's going to make up the posterior wall of the pelvic cavity. All right, so some of the structures. First is the superior articular process, which is going to articulate with the last lumbar vertebrae. The ala are going to be the wings of the sacrum. The transverse lines that we find are going to run in transverse orientation, as you can imagine, and are the product of when the sacrum has fused. The sacral foramina are going to be the holes that we find within the sacrum that give passageway for nerves to the pelvic organs. The median sacral crest is going to be found on the posterior portion predominantly, but we'll also see remnants on the anterior portion. And it's due to the fusion of the spinous process of the individual sacral vertebrae. The sacral canal will be where we have the passageway for spinal nerves to penetrate through, and then down here is the sacral hiatus that I've circled in blue, and this is the end of that canal. The coccyx is known commonly as our tailbone, and usually it's due to the fusion of 3 to 5 bones, but typically it's due to 4 vertebrae that have fused together. With normal curvature of our spine in the vertebrae, what we have is the cervical and the lumbar vertebrae tend to be more anterior, whereas the thoracic and the sacral vertebrae tend to be more posterior. So some abnormal curvatures include scoliosis, which is going to be a lateral shift of the vertebrae in either the right or to the left, typically within the thoracic vertebrae. Kyphosis is also known as a hunchback type of sway, where the thoracic vertebrae are going to be more posterior than normal. Lordosis, this is where the lumbar region is going to be more anterior, so commonly seen like with pregnancy or with excess weight in the abdominal region. Our sternum is commonly known as our breastbone, and this is where the ribs are going to attach based on their cartilage. So the manubrium is going to be the superiormost portion, and it's going to be the handle of what our sword of the sternum looks like. The body is going to be the bulk of the sternum, and then lastly, the xiphoid process is going to be the inferior tip. Our sternum does not completely ossify until we're about 40 years of age, so that xiphoid process is the last thing to connect. All right, and then lastly with our ribs, so we have different sets. So our true ribs are ribs 1 through 7 here, and these are true because they are going to directly connect to the costal cartilage that is connected to the sternum. Now remember, all of our ribs are going to be articulating with the vertebrae, so that's true for all of our ribs. The only difference now will be that of which will connect to the sternum. The false ribs are 8 through 12, where they don't articulate directly with the sternum. And our lowest ribs of 11 and 12, these don't have any costocartilage, and so they are just floating in essence, but are still connected to the vertebrae. And so all of these ribs, though, again, I keep saying they are going to be connected due to costocartilage, which is hyaline cartilage.